Health Secretary Cody Kinsley is joining us now to talk a lot more about a couple of things. We're talking about what they're doing to advance the care of youth mental health in the state, and we're also talking about child care. So, Secretary, thanks so much for being here. I appreciate that. So let's start there. The General Assembly starts next week. The session does, and child care is one of the top priorities for the Health Department.
Absolutely. It's great to be here, Rod. You know, investing in high-quality early education is a smart investment. Every family in North Carolina knows it because they need their kids to be in childcare. Every business knows it because they need those family members to be able to work.
Right.
And we are not just standing on the edge of the abyss for our childcare system in North Carolina. We're already on the way over the edge. Last year, 278 high-quality early education centers closed in North Carolina.
That's a lot. That seems like an abnormal amount.
It is, and that's because funding that we had temporarily because of the pandemic has run out. That's why we need the General Assembly to step up and invest additional dollars to stabilize our high-quality early education system.
And just, I think yesterday we reported that some pre-K classes were shutting down in one county. What is the real reason, the other reason behind it? Is it just pandemic dollars that have run out, or is there other stuff that's going on too?
Well, we all know that the cost of workforce is increasing in every job sector. So while we had temporary dollars because of the pandemic to try to make up that difference, it's going away now.
Right.
But the steady increase of workforce costs is making it really hard to sustain. That's why we have to increase those investments.
Childcare is expensive too, so we really need those programs to be in place.
Absolutely.
Let's talk about youth mental health. Some of the startling numbers that I saw talk a lot about how much suicide rates have increased for young people, 10 to 18 in the last decade. What are some of the things that the health department is doing to kind of stem that tide?
Big picture here is that we need to move from just keeping folks in crisis to really more broad spectrum care. For the last several decades, our system of care in North Carolina has been almost solely focused on addressing the crisis, what to do in that moment. But we have to get upstream. We've been raising the flag on this, and I'm grateful that the General Assembly just last year, finally, after years of asking for it, gave us additional resources in this space. So we've invested, we just announced $15 million for behavioral health urgent cares across the state to get more upstream. We've invested in mental health services in schools, mental health first aid training for kids, the North Carolina Psychiatric Access Line so teachers can pick up the phone when they're having behavioral problems to help support people, and then more high quality inpatient settings when you do get all the way to that point of crisis. But the bottom, we can't just keep squeezing the balloon. We've got to make sure we build out this system of care from the bottom. It's going to take us a while to do that because we didn't get here overnight. We're not going to get out of it overnight, but it's a top priority for us.
And I would imagine there's some things that you would ask people at home to do, the things that we can do to kind of help with that.
Yeah, well, first things first is that you remember that mental health issues are a real medical issue. It's not a moral failing, and so it's important to talk about. Also remember that, you know, having good mental health is not feeling happy all the time. It's understanding how you feel in the context of what's happening and then coping in a healthy way. 988 is also something I want to remind everybody about.
Absolutely.
If you are in crisis, there is a 3-digit dial number that anybody can call. Be the person to help make the call. They can help de-escalate the situation, help you get directed to care.
And I know that we're running a little bit out of time, but stigma plays a big role in this. We've had this conversation before. Stigma plays a role in how people react to mental health, not just for adults, but for young people too, right?
Absolutely. And young people are going to look to our adults for their own guidance. So I tell adults, talk about your feelings, talk about what's going on, talk about how when you've been in a tough time, you got help and you got better.
Right. Secretary, thank you. Always a pleasure talking with you. Appreciate it.
Thank you.
Thanks.